Once we have received authorization and payment for your radiation therapy prescribed by the radiation oncologist, one of the RTT members will be giving you a call to book your planning CT scan. The CT scan will take place at our EROS branch at the Medical Imaging Center. The radiation therapist will be positioning you in a certain treatment position depending on your diagnosis and the area to be treated. You will first be changed into a gown and then taken through to the CT scan room. Once in the room, the radiation therapist will show you and explain the position that you will be lying in and the immobilization devices that will be used. During the CT scan, we will also be making tattoo markings or skin references on the body in the area that we need to treat. These markings are very important. Without them, we won't be able to reproduce the setup on a daily basis when you come for your radiotherapy treatment. If we are treating any area in the head and neck, we might also be making a mask to assist you in keeping the exact same head position every day for treatment. This is to ensure that we are only going to be targeting the area that we are concentrating on while avoiding all the other organs closely associated to the area. Once the CT scan is done, you will be taken off and you are free to go home. It takes between 5 to 7 working days to get the plan ready for you to start with your radiotherapy treatment. There are circumstances in which the oncologist will need you to have contrast media injected during the CT scan to have a better image to make it easier for him to do the treatment plan, and the radiation therapist will arrange for you to get the necessary bloods done to ensure that contrast media can safely be administered. There might also be additional preparation to do, for instance having a full bladder and having some bowel preparation done, but the radiation therapist will communicate everything clearly before the appointment. Once the radiotherapy plan is ready, one of the RTT members will be calling you to book your first appointment time. The treatment can be given at either our EROS branch or our Kommersdal branch. Both machines are exactly the same and the staff also rotate between the two departments. The treatment can take anything between 5 to 37 working days depending on the diagnosis and stage of the cancer. Each session is about 15 to 20 minutes and the patient feels absolutely nothing during the treatment. Once arriving for your first session, you will report to reception and one of the radiation therapists will take you through to the treatment room. They will get you changed into a gown if necessary. Once you are in the treatment room, the procedure will just be explained to you once again. As you can see behind me, this is how the treatment room will look, and this is what is called a linear accelerator. You will be positioned on the bed in exactly the same position as you were at the CT scan. Once we have you in position, lasers in the room will be used to align the markings that were made on your body or on the mask that we had made during the CT scan. You will be left alone in the treatment room while the treatment is being delivered, but there are CCTV cameras in the room and we are keeping an eye on you all the time. The most important part is just to lie very, very still to ensure that your treatment is accurately delivered. The machine itself, the stop part, will just be rotating around you. It will never come into contact with you. And like I said, you will not feel the radiation physically being delivered. Once the treatment session is done, the radiation therapist will come back into the room and take you off of the bed, after which you are also free to go home and you will get a schedule with all your appointment times for the next sessions to take place, and you will also be seeing a radiation oncologist once a week for a checkup to see how you are doing on treatment and if you are experiencing any of the side effects, that the necessary medication can be prescribed. The side effects that a patient can experience is highly determined on the area that we are treating, the amount of radiation they will be received, and whether they are also receiving chemotherapy at the same time as their radiation therapy. Once your radiation therapy treatment has been completed, you will have a final visit with the oncologist. During this appointment, a follow-up date will be given to you, at which time you will come and see the oncologist again to see the treatment outcome and to also determine whether you have recovered from any side effects that you might have experienced during your radiation therapy treatment. The oncologist might also request certain diagnostic tests, scans, blood tests to be done and the result to be brought with on the day of the follow-up visit. Follow-ups start at 6 weeks. Afterwards, it will continue on to every 3 months and then to every 6 months. But you will be continually following up with the radiation oncologist to see the outcome of treatment.